If I can just mention about our time at Nasser Hospital.
Can you introduce yourself?
Yes, I'm Dr. Ahmad. I'm an emergency medicine physician and a board member for Med Global. I was in the Gaza Strip in January as a part of the WHO's emergency medical team, as a part of Med Global's delegation. And so we were at Nasser Hospital. Nasser Hospital was the second largest hospital in the Gaza Strip, and during the time of the war, it was the largest hospital while we were serving there. We were seeing hundreds of trauma patients because Khan Yunis was the center of a military operation, and we were also seeing many thousands of displaced people sheltering in and around the hospital. While we were receiving the trauma patients, in the background you would see children in the hospital, families sheltering with mattresses. And as my colleagues have mentioned, one of the concerns that we all have and the urgency of all of this is that the healthcare system has essentially collapsed, and that the hospitals that used to exist prior to October 7th are no longer standing and no longer functional. Shifa Hospital, which has been in the news as of 2 days ago, is the largest hospital in Gaza. And with respect to what happened at Nasser, in the subsequent weeks while we were there, we saw that it was ultimately under siege and then raided, with 70 of its healthcare workers arrested and rendered inoperable, with many of the people having to go further south to Rafah, where already 1.4 million people existed prior to what happened in Khan Yunis. Many of the healthcare workers there decided to stay. I was one of the people that decided to evacuate prior to the raid and the siege. And I think it's important to share some of their stories, to share what they're going through, because they're incredibly heroic people who are deciding to prioritize the health of their patients despite having a legitimate threat against their safety, their security, and their life. And one person in particular was an ICU doctor that had his arm broken while he was on his way to the hospital. He had been unable to care for his patients, and he's somebody that is a part of the problem with the healthcare system collapsing. The second part of this that I want to mention, in addition to hospitals having to be subject to attacks and having to not be able to operate and having their staff arrested or killed, 400 of whom have already been killed during this war, is us not being able to provide them with the support that they need and the equipment that they need and the supplies that they need. On our way entering into Gaza, we saw hundreds of trucks stalled at the border on the Egyptian side. We know that these trucks have baby formula, we know that they have many items, and I just wanted to show what some of those items may look like. Diapers, inhalers for those with asthma, and this small vial of medicine here is a medicine that we use for sedation, midazolam, Versed. This is something that we could be using for our patients who are there, who are in pain, who are we're trying to reset their fractures, we're trying to clean their burns. It's an incredibly painful process, and this is something that can help. Something this small, we're not able to get into the Gaza Strip because the trucks are stalled. Or if someone is having difficulty breathing, as you may suspect may happen as bombs are dropping and the air fills with smoke, not able to get a rescue inhaler in to be able to treat their asthma. Or diapers for family members. We've heard of people having to use plastic bags because they cannot find diapers, and if they do find them, the price of them is incredibly high because of inflation and the lack of supplies entering. And so I hope that this is something that can bring home what we're talking about and the urgency that exists on the ground. We need our hospitals to be able to stand. We need the bombs to stop dropping, hopefully through a ceasefire. And we hope that we can get the necessary aid that's in to help alleviate the incredible amount of suffering that's taking place in the Gaza Strip. Thank you.
Hello, my name is Amber Alian. I'm a pediatrician, and I'm the medical program manager for Palestine, Afghanistan, and Haiti with Doctors Without Borders. What I'd like to talk about, after having heard what my colleagues have seen and what we've all seen, including the teams with MSF, is how exactly is the health system collapsing and where do we go from here? MSF has been working in the Gaza Strip for about 15 years. We've been doing either orthopedic surgery, trauma surgery, burn surgery, or mental health, or a combination of all three. Since the start of the war, we started working in Shifa, we've been working in Nasser, we have a hospital in Rafah that does post-operative care, inpatient and outpatient care. We have a team working on post-delivery care for pregnant women, screenings for malnutrition, primary care, working with chronic diseases. And what we have seen is a complete devastation of the healthcare system. And when Thaer talks about not being able to get midazolam or diapers or inhalers, and it's absolutely true. There's another component, which is when the medicines do get in, how do they get to the right place, and how do they serve the people in need? There is a huge focus, for example, on surgical care, which is absolutely necessary. But when you have a child who's having a seizure and needs to be treated, there's not enough medicine to go for the person who needs to be sedated, to be intubated, or the child who's having a seizure, and doctors are being forced to make choices in those cases. We have a system where the hospitals rely on quota systems for how many drugs they keep in their pharmacies and their stocks in each department, and they have to choose between whether do I fully stock my operating theater, my ICU, or my emergency room. And this is where you have doctors faced with horrific decisions of having to intubate and amputate children and adults without anesthetics in emergency rooms. Part of the reason for this is the lack of medications, or the lack of medications accessible at that time. Part of the reason is that we have internally displaced people living in hospitals, sheltering in hospitals because they have nowhere safe to go. And what that means is they are staying in hospital beds. So what does that mean for injured people? They arrive, they get a quick and dirty surgery in an emergency room or in an operating theater, and they have nowhere to be hospitalized afterward. Or when they are lost all throughout the hospital, and our teams spend all day searching for the patient that they just operated on 12 hours before. What does this mean over the long run? The longer this war goes on, the longer these wounds have to rot. And I mean really rot. The infections are getting worse and worse, and it's horrific. It's horrific for our providers, and it's absolutely horrific for these patients. We have seen patients who've traveled, who were victims of explosive injuries, a family of 11, for example, a whole family that arrived to our hospital in the south from the north. They've been moving for 3 months looking for hospital care. They were victims of explosions. 11 members of the family were burned. The woman that we received had her 2 children with her. She had 3. The 1-year-old died on the way due to sepsis. This is what's going on. This is one out of many thousands of stories. The hospitals can't cope with the burden. No hospital in the world, high income, low income, could cope with the amount of injuries that we're seeing and the needs that we're seeing on the ground. When we talk about helping this population, which is a very resilient population, and a hospital may be rendered dysfunctional one day, and a week later you have the entire staff showing up saying, okay, well, let's clean it up, let's start over again. When we talk about helping this population, we talk about we need access. Our doctors need access. Our nurses need access. They should not be targeted. We've had ambulances targeted. We've had convoys of medical personnel targeted. We've had hospitals targeted, clinics targeted. The shelters where staff have been targeted. In order to be able to ascertain whether there is malnutrition, for example, across the Gaza Strip, you need to be able to do surveys among the population, which means you need to be able to access and touch the population. What we've been able to do is extrapolate from the few patients, the relatively few patients that we've seen in our clinics, the numbers of malnutrition that we're seeing. But what we know is that we can't access a whole host of children and pregnant and lactating women who are the most vulnerable in the north. And we know that they don't have access to food, or what food they have is exorbitantly expensive. To be able to access this population, we need access that's safe for the medical providers, as I said. 2 populations are particularly vulnerable. Pregnant and lactating women who were already facing iron deficiency anemia before the war, which puts them at risk for hemorrhage during birth. With the war, it puts them in a state of undernourishment or malnutrition, potentially malnutrition, which means that they can't breastfeed their children properly. The milk doesn't necessarily come in, and it's definitely not enough. And the other population is children under 2 years, which is the breastfeeding age. There's not enough space for us to work closely with the mothers to help them start lactating again. We can't even access them, and to be able to do that, you have to have day-to-day activities with those women, and that is not something that's possible for us right now. Those children need to be breastfed. If they can't be breastfed, they need formula. To have formula, you need clean water. None of these things are possible. What we're talking about is women who are squeezing fruits, dates into handkerchiefs, into tissues, and drip feeding their children with some sort of sugary substance to nourish them. The consequences of this over the long run mean that there is a lack of bond between the mother and the child. It means that there are physical and psychological delays for these children to develop. And in the future, for those children who do grow up, it means they are more at risk of having high blood pressure, of having diabetes, and other complications. When my colleagues talk about the injured patients, as I mentioned at the beginning, these wounds that begin to rot, how many people are going to need prosthetics? What is the socioeconomic status of Gaza going to look like in 5 years, in 3 years, in 3 months? How can this population that is so incredibly resilient rebuild itself? And the longer the war goes on, the harder this becomes. It's not impossible, but it just becomes harder and harder and harder. And the sooner we act, the better.
Great. We will